Good morning. My name is Taye Oni. I'm a postdoc psych student. I am here today to present an integrated therapy on my patient. Mr. Mo is an 18-year-old Black male who presents to the clinic today with a history of depression. He has been under my care for the last 2 months. This is a follow-up appointment for Mr. Mo, who says that his problem started about 3 months ago after the sudden death of his mother. He says that he started feeling down, feels sad, with little energy, loss of appetite, and loss of interest in attending to things, including loss of interest in going out with his friends, and that he has started to have difficulty sleeping. The patient added that he started feeling bad about himself and does not like to get out of bed. He feels that his life is a failure, or because no one can ever care for him like his mother. Mr. Mo says his father brought him out by force to the clinic to seek help when he noticed that his symptoms have been going on for over 2 weeks and that he has started to lose weight and is looking unkempt. This is a follow-up appointment for Mr. Mo, who has denied suicidal ideation. The 3 therapies of choice that I'm going to use for Mr. Mo's problem are COPE, creating opportunities for personal empowerment, interpersonal therapy, and client-centered approach. The first therapy is, like I said, is COPE, creating opportunities for personal empowerment, is a cognitive behavioral therapy. COPE therapy believes that how you think affects how you feel and eventually how you behave. When you think positively, you will have less stress. The goal of COPE is to replace negative thoughts with positive thought. Though one cannot change how other people think about one, but one can choose how to react to people's feelings or how people feel about them. You can reprogram your brain to read or say positive things to yourself. An example is positive self-talk. Positive self-talk is used to replace negative talk, thereby helping patients develop techniques to redirect their thoughts. The key terms here are positive self-talk. A person can use positive self-talk to think optimistically and feel motivated. Identifying negative self-talk is the first step toward thinking more positively. Another key term is negative thoughts. Negative thinking can contribute to problems such as depression, stress, and low self-esteem. Another key word is thought. Another key term is positive thought. It is an emotional and mental attitude that focuses on good and expect results that will benefit you. It's about anticipating happiness, health, and success instead of expecting the worst. The second therapy is interpersonal therapy. It's a short-term form of psychotherapy. It is good for the treatment of depression and other conditions. It is a focused, evidence-based psychotherapy. As its name suggests, interpersonal therapy focuses on patients' interpersonal relationship and social interaction, including how much support patients have from others and the impact these relationships have on their mental health. The goal is twofold: to help patients function better socially and to reduce their feelings of depression. Interpersonal therapy focuses on checking the mood of patients to assess the symptoms of depression. The key terms here are mood rating, which is rating mood at a scale of 1 to 10 to assess mood. Then another key term is days of best and worst mood, which means what did the patient do and where was the patient when his mood was good and vice versa. Another key term, events associated with best stroke worst mood. What event makes patient mood good or worst? Another one is linking mood with events using the mood rating. Linking mood is another key term. So the third therapy is client-centered approach. It's a type of humanistic therapy. The client-centered approach is based on the modality that every person has a capacity and desire for personal growth and change. It helps resolve conflicts, recognize values and approaches to life, and teaches the client to interpret their thoughts and feelings. Client-centered therapy or person-centered therapy is a non-directive approach to talk therapy. It requires the client to actively take the lead during each therapy session, while the therapy acts mainly as a guide or a source of support for the client. Person-centered therapy allows the client to steer the ship. This means a great help to the patient and helps them to change their behavior and their beliefs in interfering and how their beliefs interfere with their mental health. Ultimately, this approach can increase self-esteem and promote an active approach to life of a person with depression, anxiety, and other general life difficulties. The key terms here are congruence, genuineness. Congruence is a term used to describe a state in which a person's ideal self and actual experience are consistent or very similar. Another term is unconditional positive regard. This means the therapist avoids judging the client for any reason, but accepts him or her fully. Another key term is accurate empathic understanding. This means that the therapist senses accurately the feelings and personal meanings that the client is experiencing and communicates this understanding with the client. The patient will be allowed to express his mind while the therapist will listen attentively and empathically without making judgment. The reason I choose the three therapies is because they can be used in blended and symbiotic ways to help my patient develop insight and solution to his problems in the context of individual psychotherapy. These therapies will work because they have been evidently proved to help patients suffering from depression. I'm now getting ready to give therapy to my patient. I'm using COPE therapy, which is my first therapy. This is because it is a cognitive behavioral therapy. I'm using it for my patient, Mr. Mo, because it helps patients change their negative thoughts to positive thoughts, and because it is evidence-based. I have my patient here with me, Mr. Mo. Welcome, Mr. Mo.
Thank you, doctor.
Mr. Mo, do you understand and give consent for this session to be video and audio taped and submitted to Brahman University?
Yes, I consent.
Thank you. Please tell me the thoughts that usually comes to your mind that makes you sad.
Okay, I feel like I'm a failure because no one can ever take care of me like my mother would do.
Wow. Do you have the thought of killing yourself?
No.
I would like you to practice positive self-talk by saying the words to yourself 10 times. I'll tell you the words that I would like you to say. This will help to boost you. So I want you to say, I am not a failure. I am a success. I am not a failure. I am a success. Can you please say it?
Thank you. I am not a failure. I am a success. I'm 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 not a failure. I am a success. I am not a failure. I am a success. I am not a failure. I am a success. I am not a failure. I am a success. I am not a failure. I am a success.
Thank you very much. So how do you feel after you say this positive self-talk to yourself?
Oh, I feel very good. I feel quite better about myself. Thank you, doctor.
Oh, I'm so happy. So I would like you to, when you get home, select a time that you want to say this, maybe before you sleep at night or in the morning, recite it over and over. Okay? So I'll see you in 2 weeks.
Thank you, doctor.
Okay, thank you. The second therapy session is commencing, and I'm using the interpersonal therapy. I'm using interpersonal therapy because it is a short-term psychotherapy. It is good for the treatment of patients suffering from depression. It is focused and evidence-based. Today, I have my patient here with me, Mr. Mo. Welcome, Mr. Mo.
Thank you, doctor.
Okay, Mr. Mo, do you understand and give consent for this session to be video and audio taped and submitted to Brahman University?
Yes, I consent.
Thank you very much. So, before we go on, I want to ask you, do you feel like killing yourself?
No.
Very good. It seems as if there's progress in the therapy. I say you look more, your affect today, you look better than the last time. So I'm glad the therapy is working.
Thank you, doctor.
Okay. So in the last 1 week, on a scale of 1 to 10, how has your mood been? 1 being the best and 10 being the worst.
Well, on Tuesday, my mood was like 3 on 10. I was very happy. But on Friday, my mood was like 9 on 10 because I was very sad.
Okay. Where were you when your mood was 3 over 10? And where were you when your mood was 9 over 10?
On Tuesday, when my mood was 3 over 10, I was hanging out with my friends while I was at home with my father and sisters on Friday when my mood was 9 over 10.
Okay, you are with your father and sisters. Okay. Thank you, Mr. Mo. I will look into the matter and then we'll talk about it in our next session. So see you in 2 weeks for another session of psychotherapy.
Thank you, doctor.
Thank you. Our next session of therapy is the thought therapy that I'm offering for my patient. And the therapy is centered approach, is client-centered approach. It is a type of humanistic therapy. I'm using it because it promotes personal growth. It helps patients change their behavior, the behavior that is interfering with their mental health. It increases self-esteem. It is good for patients suffering from depression, and it is evidence-based. I have my patient here, Mr. Mo. Welcome, Mr. Mo.
Thank you again, doctor.
Mr. Mo, do you understand and give consent for this session to be video and audio taped and submitted to Brandmans University?
Yes, I consent.
Thank you very much. Before I begin the therapy, I want to ask you, do you feel like killing yourself? Any thoughts?
No.
Very good. Thank you. So in this session, I'm going to give you 2 minutes to tell me what has been going on in your life, what bothers you, and what you have to say about it.
Thank you, doctor.
So I will listen to you as you express yourself.
Okay, doctor. So I do not like the way my father and siblings treat me at home. They think that I am the black sheep of the family, and there is nothing that I do that makes them happy. They always see me as a pin in their boat. If I turn on the television, they will comment that I am watching the wrong channel. When I use the bathroom, they always accuse me of not flushing. And to make the matters worse, when I report to my father, he's always siding up with my sisters, maybe because they are girls. You see, this is why I miss my mother so much. I don't know why she has to die at the time that she did. I was not expecting her to die. Her death is so sudden and so painful. Well, I know there is nothing I can do about it. Oh, how I really miss my mom.
It must be really hard for you.
It's been really very hard, doctor.
Anyway, we will continue the therapy in the next 2 weeks. Thank you. See you in 2 weeks. Continue to say positive things to yourself, positive self-talk. Continue to ruminate on what we discussed. Thank you so much.
Thank you again, doctor.
See you in 2 weeks. Combining the therapies is better than just applying one or using just two. As it can be seen from the three therapy stations, Mr. Mo begins with COPE therapy, a form of cognitive behavioral therapy that helps him to change his thought pattern from negative to positive, while the interpersonal therapy allows the patient to rate his mood, determining the triggers of joy and sadness with the goal of encouraging the event that promote joy and happiness while discouraging or trying to fix events that trigger sadness. To crown it, the client-centered approach therapy helps the patient to take the lead in the therapy session by allowing him to express his emotions while the therapist listens attentively without being judgmental. This helps to boost patient's self-esteem while alleviating his fear, worries, and depression. What a great combination of therapies. Culturally, it is paramount to understand that the diversity of beliefs within cultures, regions, and population demands the need to understand the individual patient's perspective. Mental health-related stigma is consistently identified as deterrent to help those who carry these negative attitudes. So, it is discovered that some African Americans do not want to go for therapy. So this is why the father has to force the son to come. So in summary, with continued psychotherapy, Mr. Mo's problem of depression will likely improve because the three therapies are evidence-based with quality outcomes. Building relationship and trust and empathy between the therapist and the patient cannot be overemphasized for continuation of care. Thank you. The session will continue in 2 weeks.